licensed as a psychologist. And then since then, I've been doing clinical work, teaching here at Boise since 2000, and most recently at Ryerson in their clinical psych program this past year in the PhD program. I also teach a certificate course that's Boise in the Hinks in advanced CBT, which tips you onto the fact that I'm a cognitive behavioral therapist. That's what I do. That's what I like to do. So I tried to think about what would be most useful for you. I believe you're all in the MA program, is that right? MEd. And any PhD level or EdD? Okay, so a mix. So one of the questions that I've been asked is, do employers tend to distinguish between an MA and an MEd? And I pose, the directors of counseling centers across Ontario meet twice a year, and so I pose this question to my colleagues to ask, in counseling centers anyway, do they make that kind of distinction? And I would say the greatest distinction is between a master's and a PhD, rather than lateral MA to MEd. And I imagine that there are going to be changes after the College of Psychotherapists and Mental Health Therapists comes into play. So this will be old news, I imagine, once that is 2014, is that right?
Something like that.
Yes, so it's a couple of years from now, and I would encourage you to be looking at that legislation to see if it applies to you. Because there will be probably other kinds of standards in play once that kind of accreditation comes into process. So what are we looking for when we hire a counselor in our counseling center? We're looking for training and experience as a therapist, okay, because that's what we do. So your coursework is necessary, but it's not a sufficient criteria by which to choose appropriate candidates. I tend to hire people with experience in and training in cognitive behavioral therapy, in crisis intervention, and then with some kinds of specialty or background optimally. So either eating disorders or anger management, multicultural issues, working with depression, working with anxiety disorders, some kind of area of specialization that they have a strength in, and then from there building. So really my attitude has always been to hire for attitude and train for skill. So it's somewhat contradictory. So I'm looking for some basic skills, but really what I'm looking for most of all is somebody who has passion for the work, is willing to go the distance, is a team player, really interested and passionate about doing therapy. And with that attitude, you can pretty much shape any new therapist. What kind of courses are most important to take? Well, I'd say ethics is critical. It's the rules of the road. If you don't know them, you can't really be a therapist. Obviously, a practicum, therapeutic skills courses. Research is very useful if you're planning to be an academic, but it's less useful to be job ready. It's interesting, but it's not going to be a criteria that's going to make you competitive in the workforce. So what do I recommend that you do in order to be job ready? I have a lot of recommendations. So one is choose your practicum placement wisely. So think about what kind of work you want, because you're in the process of now accumulating the experience that will get you the job that you want. So line it up based on your passion and your interests. So your future dream job should be something that you're training in now. This is your one opportunity to get in the door and get the experience without having any experience. So that paradox doesn't apply here. Working in hospitals, although there are not a lot of hospitals that train at the MA level, there are some. In my day, hospitals abounded because there were psychology departments in all the hospitals, and now there aren't. So other than CAMH, you have to go somewhat more afield to find hospital training, but it's really worth getting if you can. I also recommend training and experience in crisis intervention. No matter what your job, you're going to have to be able to manage a crisis if it walks in the door. So distress hotlines, mobile crisis teams, Gerstein Center, volunteering at emergency rooms, even working at employee assistance programs. All of them have a component of crisis intervention, and it's a really good idea to know how to do a suicide risk assessment. What are the resources in the city? How are you going to manage any situation that's kind of outside the box? So train for that. There's a lot of controversy, I think, at Boise around the DSM, and it's about to change anyway. But you can't function in a mental health setting without being familiar with the DSM. You need to know and recognize what the psychiatrist or the physician or whatever other mental health professional is talking about. You need to be able to recognize and understand what you're dealing with. And if you don't have that knowledge, you will find it much harder to manage in the workplace, in my opinion. It's not perfect. It's not even close to perfect, the DSM. But it is the tool that we're using, so you should be familiar with it. So learning basic diagnoses for things like depression, the anxiety disorders, eating disorders, grief reactions, they are so common. No matter where you are, you will be seeing it unless it's a specialty clinic and then you'll see that. Treatment planning, case conceptualization, learning how to write a record, keeping appropriate records in a timely fashion. All of those things are skills that will allow you to keep a job once you're in it, if you do get it. I also recommend that you train and practice in one modality first and learn it well and become eclectic as time goes on. But I think becoming eclectic too early on means that you don't learn anything thoroughly, and then what you're doing is more random and not necessarily going to help you in the job market, because people will ask, what's your modality, how do you think, how do you conceptualize your cases? And if you don't have that grounding, you're at a disadvantage. I think it's important to decide what you're really interested in and then develop some expertise, or at the very least get experience in doing that work. So knowing what you want is the first step in selecting what kind of training, what courses to focus on, who to work with in terms of research, all of those things. So there should be, my recommendation is like a strategic plan of some sort, how to line everything up to get where you want to go. And I don't know how much that's shaped through your courses here or not, but it's something to consider. I think developing relationships with potential references is a really good idea. So if you've had an instructor or professor who you feel has a very good sense of your clinical skills, make sure that you've noted that so that when you're looking for a good reference, you have someone who knows your work well. And if possible, from clinicians rather than people who supervised you, rather than from academics who may know that you write a great research paper, but not necessarily what you would be like in the room with the client. So a profile of a candidate that I might be interested in hiring, just as kind of representing the counseling services generally. So someone who's already trained in a post-secondary counseling center and a hospital setting. So I would be interested in having someone who has both. Certainly experience with crisis intervention, suicide risk assessment, and management are absolute important skills. Knows CBT well, knows how to do a thorough intake, think through a complex case, develop a treatment plan, and how to implement it. So those are basic entry-level skills as a clinician. Knowing your own limitations and when to consult and when to refer out is also a real skill. Taking on things that you're not competent to do is really ill-advised, so knowing your limits is really important. Awareness of community resources and how to access them. A long time ago, it used to be the Blue Book, now it's 211 Toronto, but knowing how to navigate it and find the appropriate resources and tapping into where research studies are going on for easy access to free services, etc. Those are all important skills as well. Working in a multidisciplinary team is really important. There are very different mindsets for different professions, and we need to be able to navigate through how a psychiatrist would be working differently than a GP or a social worker or even OTs in hospital settings. And I think the expectation today generally is you have to be able to manage in a multidisciplinary team, that you can't assume that everyone has been trained as you have. I think having enthusiasm about professional development and continuing education is really important. I heard a long time ago that the half-life of a PhD was 5 years. So what that means is after 5 years post-graduation, half of what you've learned is now obsolete. So I'm not sure what it is for an MA, but the assumption is if you don't keep current with either research findings or workshops or courses, then you're going to become obsolete very quickly. Your knowledge base is changing all the time through new developments, and so that's a critical part. Having passion and commitment for the work is incredibly important, because if you don't, you burn out. And then finally, although this is not in order in any particular order, and my two colleagues from the Counseling Center at my left will laugh at this one, but it's true, having good, time-sensitive record keeping. You have to be able to stay on top of your notes.
And it's really hard all the time.
And it's really,
Really hard
hard.
and absolutely essential.
Yeah.
If you can't do that, at least, from the perspective of the college of psychologists, it's really not practice. I mean, the assumption is you have to be able to stay on top of your notes and your reports or whatever you're working on in a timely fashion. If that doesn't happen, it just becomes a runaway train, and you can't get it back. So those are things, the ability to do that, to manage your time, allocate enough time to do what you need to do, is a skill set really worth developing. So you all have that as students, you get things in on time. So this is different because it's daily work. Those are my thoughts. Any questions before I sit down?